are live. Hello, everyone. This is Dr. Afrouz Demeri, naturopathic doctor and director of functional medicine at University of California, Irvine Samueli Health Institute. That's a mouthful, but I'm honored to have Dr. Zwickey. She's pretty world-renowned for being sort of the only immunologist I know of that has such extensive knowledge in natural medicine herbs. I will link down below all her credentials because it will take me 15 minutes to go over everything. But she's a professor of immunology at a university that many of my colleagues go to, and we really look up to her for her knowledge. So I'm honored to have her here.
Thank
Hi,
you.
Dr. Zwickey.
Yeah, I'm happy to be here.
All right, so let's begin. Today, as you all know, we are talking about COVID-19, and I really want to get the immunology expertise because most of us doctors are not immunologists, infectious disease expert, and there's a lot of noise out there. And today I really want to bring her on, but the main reason this has become so important to me is because I lost two patients over the age of 60 in January who I now suspect was due to this. At the time, they didn't have a lot of severe symptoms. They had cardiomyopathy. However, they had low oxygen levels, and I remember sending them to cardiology, sending them out to pulmonology, and unfortunately, they died pretty quickly. And looking back now, this was at the beginning of January, this is probably what they had. So I'm making this in their memory, and what they loved about me was they always said that I help them with the terrain, their host. The virus needs a host. And so as much as scary as this is, and most of us feel like we are not in control, I do want to emphasize that we are in control. And there's a lot we can do to help the terrain or the soil or your host. So let's start off, Dr. Zwickey. If you can comment on what is this virus? What is the SARS-CoV-2 virus that causes COVID-19?
So the SARS-CoV virus comes from a family of viruses that we call coronaviruses. And this particular virus has a couple of mutations that make it much more virulent than other coronaviruses. Most coronaviruses just cause things like a common cold, but because of the mutations that this virus has, there are 5 specific mutations, it makes it much more severe. It makes it much more virulent.
Right. And I know there's all these jokes out there right now on the corona and the beer, but what does corona actually mean? Why is it called coronavirus?
So corona means crown, and if you look at the little proteins sticking out of those viral particles, they give it the shape of a crown. And so corona is the name crown in Latin, I believe.
Yes. And what are these little spikes? What do we call them? And how does that, why is that important, these little spikes?
So those little spikes are what the virus uses to make a handshake with the cell it's going to infect. And those spike proteins, we call them spike or S1 in coronavirus, those spike proteins are going to make the virus specific to different animals. So it might be why it would infect a bat versus a human, but they will also make it specific for the particular tissue that the virus is going to attack. So in this case, this virus is capable of attacking lung tissue, gut tissue, kidneys, your renal tissue, as well as the central nervous system.
Wow. So the brain. So that's why sometimes we're seeing some neurological symptoms. Or we had a patient at UCI, one of the first cases, she just had nausea and vomiting and a fever. And, I suspect many of us have probably even been exposed and just thought it was a stomach flu perhaps, or someone's dizzy and having neurological symptoms. So it's great to hear that it's not just the lungs, which is what we originally said, that everyone was probably going to have respiratory issues and a cough. There are cases we're seeing correct that those are
Yes.
not there.
Yes, indeed. In fact, if you swallow the virus instead of breathe it, then it's going to go to the gut. And some people just have GI upset. It's important to note that for the folks who have GI upset, that the virus is actually being shed in their stool. So you have a different route of infection at that point. Then it could be fecal oral as opposed to the respiratory droplets that we usually think about.
Great. Yes, that's a good point. So, talk to us about the immune system, not from a medical doctor, what we learn in medical school, but what does the immune system do? What kind of departments are there in the immune system?
So the immune system is the guard dog of your body. It's the part of your body that's looking for foreign invaders, and it's determining what is safe and what is not safe. So everything that you put in your body is surveyed by your immune system. And when you put food in, your immune system has to determine that food is safe. But if you put in things like virus or bacteria that might be pathogenic, then your immune system has to determine that that's not safe. The way that it does that is it goes through this process where it looks at all of the proteins on the substance. So in this case, it's going to look at those viral spike proteins, and it's going to say, there is nothing in my body that looks like that. That is foreign.
Right.
And then once it sees that it's foreign, it has to say, okay, now is that foreign food or is that foreign pathogen? If it's foreign pathogen, it stimulates what's called an innate immune response first. So in the innate immune response, you go through inflammation. This is when you experience things like a fever. That's when your proteins of your immune system that are called cytokines, this is like your hormones in your immune system, float up to your brain and say, hey, there's an infection. We need to raise the body temperature. You also experience some swelling. And in this case, because the virus is in your lungs start to fill with fluid. And that's called edema. And we see that happening. You experience pain, and that pain might come out as muscle aches or headaches, those sorts of things people are experiencing, but that's all part of the innate immune response. Now, what's interesting about the innate immune response is that it also makes you feel sick. So, when you want to stay in bed and you're feeling really tired and malaised and depressed, that's your innate immune system. And it's the same proteins that are raising your temperature that are causing you to feel those symptoms. Likewise, when you feel anxious, when you think, oh my God, I might have coronavirus, that is those innate proteins of your immune system triggering your brain to feel anxiety. And so we know that the innate immune system is responsible for changing a bunch of parts of your body, but also responsible for the symptoms that you feel. Once you go.
Can I ask you about one of the cytokines or the IL-6 you mentioned? Yeah. That, people who have elevated levels of this, what have we found clinically?
Yeah, so interesting with IL-6 is that, so this is our anxiety cytokine, right? So people who worry a lot have elevated levels of IL-6. And clinically, we know that if you have high levels of IL-6, number one, it contributes to all sorts of secondary comorbidities. So we think about diabetes and asthma and cardiovascular disease and hypertension. All of those diseases have high IL-6 associated with them. But specific to this virus, we know that the virus causes very high levels of IL-6. And that's one of the problems that people might experience, is that they can't get their IL-6 to go back to a normal level again.
Okay. Sorry, I interrupted you. So we understand the innate system. How is that different?
In the innate immune system, we go onward in our immune response to what's called specific immunity. And in specific immunity, our immune system is specifically targeting virally infected cells. So you can think about this as a sniper. It's not trying to wipe out everything. It's literally going for any cell that has virus in it and killing it. Now, where are the virally infected cells? if they're in the lungs, it means that your immune system is killing lung tissue because it's killing all the virally infected cells in the lung, which is why people, when they get to a certain level of infection, they're doing damage to their lungs. Likewise, if the virus is in the kidney, you'll be getting kidney damage, or if it's in the gut, there will be damage to the gut. So all of those things are happening during the specific immune response. As we move on in a normal infection, we then resolve the response. And as we're resolving the response, you're starting to feel better. You feel like, hey, maybe I could go outside. Doesn't mean that all the virus is gone, though. It just means that you're on the downward slope. You're getting better. And then finally, we have what's called a memory response. And the memory response is how we design vaccines. This is keeping some of those immune cells that are specific for the virus around so that if you get exposed again, you can attack it more quickly and more efficiently.
Amazing. Wow, I love the way he described that. Makes sense. All right, so moving on, I have lots of questions for you. How do we normally treat viruses?
Well, viruses are not bacteria, so we don't often have drugs to treat them. We've got a few. We've got some antivirals that we use for HIV and hepatitis, but usually it's our immune system that takes care of viruses. So what we do is we stimulate a particular type of immune response that is called a Th1 response. And a Th1 response is supposed to help us fight bacteria and viruses. Now, in this situation, we know that some people are overstimulating their immune response because of the virulence of this particular virus. So for some individuals, stimulating an immune response for this virus is just fine. And for other individuals, if you stimulate the immune response, they may not be able to shut it down because of the virulence factors of the virus. One of the virulence factors actually overstimulates. Like, we know this. Two of them overstimulate, but one is really, really strong. And so continuing to stimulate your immune response can be dangerous for some people.
So they're not, there are they, because I know you've studied tuberculosis, HIV, other things, other bacteria and viruses. This is really unique in that sense, in that
It is.
over exaggeration happens from the immune system, not necessarily from the virus, or can you
Yeah,
explain?
so we have examples of other infections that do this. Toxic shock syndrome was something that did this back in the 80s. Uh, if you have an immune response to potato salad that's been left in the sun too long, it can do this, but the average bacteria or virus doesn't do this. Usually your immune system starts a response, it maintains it while you're fighting the infection, and then it goes back to normal. And that doesn't appear to be happening for some people. Now, it's not for everyone, and most of us clear it, right? And we have that normal immune response, but for some individuals, they seem unable to resolve the response at the end.
Right, yes. All right, next question is how, I think you pretty much answered this, but is there anything else you want to add in how this virus is different?
Yeah, so this virus, what it's tricking is the innate immune response. So HIV, we mentioned, HIV tricks the specific immune response. It tricks the T cells and the B cells, the sniper cells that are going to go and fight infection. This virus is actually tricking that first part of the immune response, the fever response, and it seems to be overstimulating what we call an inflammasome. So the inflammasome is when we group all the inflammatory proteins together. That's what we call it. And this virus is happening, it's stimulating that inflammasome such that early in the infection, we're getting overstimulation.
I understand. Great. All right, so how is this transmitted? I know we've learned a lot and a lot is changing week by week, but can you comment on transmission of this virus?
The primary way this is transmitted is through what we call respiratory droplets. Now, initially, we thought you had to sneeze or cough in order to transmit a respiratory droplet, or at least that's what we were hearing on the news. Immunologists knew better all along. We were saying, no, when you breathe, you transmit respiratory droplets. We've known this for a while because we know that one of the very common infections that we have a vaccine for is called Haemophilus influenza B. And we know that often when grandparents are smokers, Haemophilus influenza B is culturing the back of their throat. And then if they go up to a baby and they go, oh, you're so cute, they can actually transmit Haemophilus influenza B to the baby. So we've known that just chatting can actually transmit respiratory droplets. And now that's actually been shown that you can actually have virus, active virus, just speaking. And some of us recognize that we spit when we speak, but a lot of people don't. Yeah. The other place that this is getting transmitted is now gut for people who have a gut infection. We see that fecal oral route. And then the other thing that I like to think about that 1%, so that's not a lot of people, except when you start looking at the fact that we've got hundreds of thousands of people with infections now, 1% of people are getting this as an eye infection, meaning that they have either touched their mouth and then touched their eye, or touched something else and then touched their eye. And this is one of the reasons we tell people don't touch your face, because you can get an infection, a pink eye, from this particular virus. And it is, I know someone who's had one, and it is not fun and not comfortable and very hard to treat.
Yeah, because you can't give the typical antibiotics or the steroids that we would normally use.
Exactly.
And so this can live on surfaces. We're still in agreement on that. So touching doorknobs and handles and such.
It can live on surfaces. And I have to say, all along, I've been kind of in disagreement of what I'm hearing in the media with surfaces. Coronaviruses historically have lived on surface anywhere from 10 to 21 days. Oh, wow. And so we keep hearing, oh, it's not so bad, it's 3 days, it's this, it's that. But you know, they've now opened up the cruise ships that were initially showing infections. 17 days later, they're still finding coronavirus. So I think we're actually going to hear more about how it actually is a little bit more stable on surfaces, probably because of the mutations this particular coronavirus has. Right. Which means, again, wash surfaces. Soap and water is adequate.
How about the 14-day quarantine that we originally thought that if someone had it, they stay home and then they go back? I heard you mention that in China, they're finding that this could last a lot longer than 14 days.
So in China, the data that's coming out now is that the average amount of spread was 21 days, and they had people who were spreading for as long as 37 days, which means that if we only quarantine people for 14 days, there's a whole window that we're missing in terms of their potential to spread the virus to other people. And it's one of the reasons we could be hearing epidemiologists on these news stations saying, we know you're not staying home because we're still seeing spread. Well, it's possible that they're still seeing spread simply because there's much more shedding than anyone actually predicted.
Right. And so going back to the physical distancing, that 6 feet obviously is important, but if it's a windy day and someone's talking to you, like it's what we're saying is we can still transmit and make it into your nasopharynx or mouth or...
You can, and I do want to say something about the masks that are being required now. The virus is a nanoparticle. It's very, very small, and it goes through the average mask. So I don't want people to get a false sense of security by wearing a mask, thinking that they are protected, or that they are protecting others from themselves. Really, if you watch the Surgeon General make his mask on TV, he had 8 layers of material by the time he folded that mask. With 8 layers, you may actually prevent a little something, but with the little paper masks that you can buy in the grocery store, they're not actually protecting anyone from anything. So I actually am one of the folks who disagrees with the CDC on requiring masks, because I think it gives people a false sense of security.
Absolutely. Yeah, I'm glad you mentioned that. Thank you. All right, what are the risks? Who is at risk for not just contracting this, but having it be fatal or be very severe and not recovering well?
Yeah, I think we've learned at this point that the risk for people contracting it is everyone. Anyone can get this disease. How severe the disease is can differ depending on your terrain. And I think this is one of the reasons why naturopathic medicine is so important, because you can make your terrain more healthy or not. So, allergies. Allergies are happening right now. It is spring and they are in full bloom, just to use the right word to go with it. Now, are allergies good or bad? Well, what we know about the immune system is that this Th1 response that we want to fight the virus is in balance with the allergy response, so you're constantly doing this. If you have allergies, your allergy response goes high, which means your Th1 response goes low. What that could mean is that if you have allergies, it could take longer for you to recover from this virus. However, it could also mean that you don't have the overreaction that some people have to the virus. Again, this is theoretical. We don't know yet. We're just watching people now as they're going through allergy season. The other thing with allergies is that people experience their allergy and they worry that they have the infection. And so now they're going to rush out and try to get a test or go to the hospital. And there are a number of websites at this point that help you determine whether you just have allergies or whether you have coronavirus. The number one thing to look at is, do you have a fever?
Mm-hmm.
Allergies don't usually come with a fever. So if you have a fever, then you might say, oh, I might be getting an infection. Whereas with allergies, you may have all the same symptoms: the headache, the runny nose, the cough, even the chest congestion, although probably not as severe as with coronavirus. But if you don't have the fever, you probably don't have an infection.
And I think in the journal Allergy, they found a difference with kids who have allergies versus adults, right?
Yes, they did. And I don't remember the
Yeah.
difference.
Yeah, I think what I remember is in adults, it can be a little bit more detrimental. Now they were looking at pollen, I think it was birch, but that they said an adult with this may not mount the typical fever that perhaps a child would if they contracted. And I know a lot of people are thinking if they have allergies, they're protected, that their immune system is somehow stronger. But I think one
Yeah,
of the recommendations we make in naturopathic medicine is to use local honey, correct? Because if you're
absolutely.
ingesting the allergen, what happens immune system wise?
So, and the key word you said is local.
Mm.
So, honey, when it is made locally, collects the pollen from that. The bees are collecting the pollen from the local area. And if you ingest pollen, you have what we call a tolerance response. It's like you're treating food.
Mhm.
Whereas if you breathe pollen, you have this Th2 response, which is a response that you would normally have to a worm, like a parasitic worm, if we had worms in this country. But because we don't have worms in this country, our Th2 response has been directed towards what we call innocuous proteins, like pollen. Pollen isn't dangerous to you, so your immune system technically should not respond to it, but it does. But there is this balance that's happening between Th1 and Th2. So some people think that because I'm having this big Th2 response, I've got a strong immune system.
Mhm.
No, when your Th2 response is high, your Th1 response, your ability to fight bacteria and virus, is lower. And that's essentially what that study was saying in the Journal of Allergy.
So is the opposite also? Could that be true if someone is very dominant in Th1 and they have, let's say, Hashimoto's or disease or pregnancy or whatever, does
Typically,
that
they
mean
won't have allergies.
they
Yeah.
wouldn't? Right.
Hmm.
But having a Th1 dominant illness doesn't also mean that they're going to be fine when they get this.
It doesn't mean that, not at all. But if you have an autoimmune disease, one of the things that we're seeing is that people are often on medication for their autoimmune disease, which means that the medication is lowering that Th1 response. which again would mean that you're not going to overreact to this infection, but it might slow down your reaction. And so one of the things we see with people who are on autoimmune diseases is that they might have the same symptoms as everyone else in the community, but they have them 2 weeks later. It slows things down because you're on medication.
Interesting. Hypertension is a big one, and we know about the ACE2 receptor, but is there anything else? Are there any genetic SNPs that could be why men have this more, or why more the Chinese men? Do they have more ACE2 mutations genetically? What do we know about that and high blood pressure?
Not necessarily. I think that one of the really interesting components with gender actually has to do with the fact that we talked about your body getting that danger signal that this is a virus when we were looking at that coronavirus. And it turns out that the receptors that you bind to get that danger signal differ between men and women. Women have more of that danger signal receptor. It's called TLR, and 3, 7, and 9 are the ones that recognize virus. And women have more 3, 7, and 9 than men. Men have more TLR2 and TLR4. So women are, right from the get-go, going to be more able to respond to the virus than men are. Then we add to that there are additional components of the immune response, specifically antibodies, that are higher in women than in men. This has been proposed to be evolutionarily conserved because women typically have had to protect a fetus. And so women make more antibody, and that's thought to be more protective. So I think that there's some immunological reasons why we're seeing higher rates of infection in men. Now, men are also more likely to die, and that can also be related to blood pressure. And there are SNPs being little specific pieces of DNA that are different from one person to another. And there are SNPs that do affect cardiovascular disease. But I think we also have to remember that if your immune system is responding and it's filling your lungs with fluid, you've got less space for oxygen. And so what your body's going to do is it's going to increase your blood pressure to circulate the oxygen that is there more. And if you already have hypertension, you're starting up here and you're taking it as far as your body can go. And so what we see is that there are people who are having heart attacks, myocardial infarctions. There are people who are having strokes and dying for those reasons because the blood pressure is so high.
Right. Yeah. And the edema and the myocarditis that's happening as well.
Yeah.
All right. Yeah.
I think one of the other things you had on there was obesity.
Yeah.
And one of the things that we're seeing, we see with diabetes and with people who are overweight is that their food choice tends to, for people who are overweight especially, their food choice tends to be higher calorie and higher sugar or carb content. And when you get high doses of sugar, it is pro-inflammatory. It stimulates that first part of your immune system to peak even higher. Now, because the virus peaks this same thing, if your blood sugar is already high and you're starting up here, it's going to take it higher yet. And so if you have inflammation or an inflammatory disease as an underlying condition, we see that the inflammation that this virus causes actually makes that pathological.
Right. And for those listening, that doesn't mean you don't eat any fruit, because I know fruit is also fructose and sugar, but
yes,
a lot of us are now afraid of eating
fruit. No, I'm concerned most about things like high fructose corn syrup. Exactly. We see a huge spike with high fructose corn syrup.
Wonderful. In terms of treatment, I don't want to get too much into this. We're going to do a whole other podcast and video on this, but we've got the antiviral remdesivir, Plaquenil or hydroxychloroquine, which is actually originally was used for malaria, correct, and came from a plant. Anything else that you want to mention on treatments?
You know, a lot of our antiviral treatments are very specific to the viruses or to the the pathogen. In the case of malaria, it's not a virus, it's a parasite, but they're specific to those particular organisms. A lot of our drugs are specific to those organisms. So we have some hope because we see some in vitro responses here.
Yeah.
But I'm cautious to put too much hope into some of the medications that are out there. The thing I would say with hydroxychloroquine is I've done work in Africa, so I've seen it used a lot for malaria.
Mhm.
And it is not a nice drug.
No, I'm so glad you said that. I always say that. Most of my patients for lupus, all these years, I've been taking them off because of all the side effects.
It's horrible side effects. Yeah. It can kill entire tissues. And so I wouldn't take hydroxychloroquine unless I had to. I mean, if this is a life and death situation,
Right.
then yes, consider taking hydroxychloroquine. But if it's not, I wouldn't be taking it prophylactically.
Right.
And the other thing to remember is that the research on these drugs so far are in vitro, which means they're in a dish, which means we don't really know what they're going to do in humans. We've seen a few cases where people have gotten better. We don't hear about the cases where people die. So I would just, again, be cautious, because doing something in a dish is not the same as doing it in a human, where you have a nervous system, an immune system, a endocrine system, and all these different things that are interacting with that drug as well.
Right. And I think that's really important to mention, because there's this big hype right now. As of yesterday, I saw that ivermectin, which we typically use for lice and parasites and illness, is shown to really reduce in vitro growth, but that doesn't mean we have any human data. So same with Plaquenil. I mean, it's hard now to find that. I have a patient with arthritis who I was talking to who can't even get her meds that she was originally on, because people are going out there and thinking they need to stock up and pile up on this, which I'm really cautioning everyone from doing that.
Yeah, I agree.
All right, in terms of prevention, obviously we want to abide by public health and CDC. There are things that everyone has heard 1,000 times. I just want to quickly mention physical distancing and not touching your face, using hand sanitizers and cleaning surfaces, washing your hands for 20 seconds, and it's all about the friction and making sure your arms are downwards, kind of like you've seen surgeons before they scrub in to go into surgery. It's so that things don't come back up. Covering your mouth and nose if you are sneezing, but again, like we said, doing that does not necessarily mean you're not going to get it. It also doesn't necessarily mean you're not going to give it to someone else. And yeah, wiping surfaces. So in terms of lifestyle, what would you say is the most important one in your opinion?
My number one thing for this particular virus is sleep. And the reason that I emphasize sleep is that there was some research early on showing a correlation between melatonin levels and degree of infection. So we know that kids have much higher melatonin levels than adults. And it's one of the reasons we think that most kids are not showing the same type of symptoms that we see in adults. Again, pregnant women have higher levels of melatonin than women who are not pregnant, and we have definitely seen that being positive. So that is not to say that everybody should rush out and take melatonin, because there's no evidence that melatonin works as an external therapy. You want your own personal melatonin levels to be good such that you can sleep for 7 to 8 hours a night. And remember, melatonin puts you to sleep and GABA keeps you asleep. So you need to have both good melatonin levels and good GABA levels. Plus, your immune system is recharging overnight. And so if you're not sleeping, then your immune system is in terrible shape. It's probably one of the most important things. And we'll talk about the second most important thing, but one of the most important things for you to do to your immune system is sleep. The second most important thing you can do is eat, and eat appropriately. So sleep, eat, exercise. Super, super important when we start thinking about how we're going to have a healthy immune system. So sleep, oh good, number one. Vegetables, yes, vegetables are absolutely important. There's research showing that with exercise, that it is more important that you break a sweat every day, so exercising for 20 minutes a day, than that you have these 2-hour marathon workouts a few times a week. So really trying to figure out how to get yourself to exercise every day. Staying hydrated, essential. And then stress levels.
Mm-hmm.
The immune system is very strongly affected by your stress level. It's affected by a hormone called cortisol, and so important is this hormone that the Nobel Prize was actually won in 1956, showing that cortisol can shut down your immune system.
Wow.
What does that mean? That means if you're highly stressed, your immune system is not available to you to fight any infection, much less coronavirus. So how are you going to reduce stress? And there's a number of things you can do. You can do meditation, you can do play music, dance, do arts, like figure out ways that are good for you for coping mechanisms, because we've got to reduce the stress. It's almost frightening to me how stressed out people are, and how almost paranoid that people are becoming. So important to reduce stress.
Yeah, I see patients who already had anxiety or old issues from their life, childhood. This is just another chance for them to heal that. And it's unlikely that someone who's never been stressed and never been anxious, all of a sudden they're going to be paranoid. So I would say use this as an opportunity for change. And you don't want to suppress stress. You don't want to not have stress. That's just not practical.
Right.
But like you said, we want to become friends with it. How can we use it for us? How can we see the body? And I'm seeing this a lot this week in patients who can't sleep because they're worried and stressed. And so those two are no good. And like you said, GABA can go a long way, which is made in the gut. So diet protein is huge. Certain herbs that we'll discuss later can help. Melatonin can help. But even ways to lower cortisol if that's acutely high right now. There are herbs that are safe that can do that. Or just like you said, a guided meditation, just taking deep breathing, and stimulating that vagal nerve, which is the nerve that tells your brain everything is good, I am calm. And so often I'll just say,
You
focus
said
on.
something really important there, and that is that what is stress? Stress is perception.
Yeah.
Stress is that there's a perception of threat,
Mm-hmm.
and there's a perception that you are unable to cope with it.
Mm-hmm.
So in this case, is there a threat? Well, yeah, there's a threat, but are you able to cope with it? Yeah, you probably are. And there's this fantastic book that was written by Viktor Frankl. He was a survivor of the concentration camps, and it's called Man's Search for Meaning. What he talked about was the people who survived were the ones who figured out how to cope with their stress, because it was a very stressful time. So thinking about that, thinking about it as like, what coping skills can I develop during this period of time can serve you for your lifetime.
Right. I love that. Oh, I could just go on and on about all these things, but let's just keep on to the question. So when will this end, Dr. Zwickey? What are your thoughts?
Yeah, I don't know that I have as positive an outlook as the University of Toronto states 6 months in the fall. What we know about coronaviruses is they typically come back in the fall. So you may actually have heard Dr. Fauci talk about this on TV, but respiratory infections typically happen in the fall and the spring. And it is entirely possible that this infection will actually spike again in the fall. Now, if it does, we may be more ready for it. We may have some drugs that are useful. We may have herbs that are useful. We may have a vaccine. We don't know yet. But I actually, just knowing the characteristic of the virus, I would expect that it is going to come back in the fall.
Okay, that's good to know. So it's not like everyone's just waiting for this 3 more weeks, 4 more weeks, and everything's going to go back to normal. It's
That's
really
right.
good to think long term. And after this virus, there's probably going to be another one. There's probably going to be another pandemic, right? It's not like this is it, this is the end.
Right. We travel now. We have a global economy. We have a global lifestyle. And so anything that's happening anywhere in the world, we need to be aware of it.
Yeah.
And we need to be aware that right now we're discovering our public health system is not sufficient. Our underlying terrain is not sufficient. We're not as healthy as we need to be.
Right. And so at the end, how big could this be? And what do we really want? Do we want to just reduce death rates? Do we want to not have more viruses around? Do we want to just find a vaccine and think that everything's good now? What's your
I
comment
think
on
what we really want is we want people to be immune.
that? Mm-hmm.
Now, how can you be immune? You
Said
can
the
go through it,
immunologist.
right? What did you say?
I said the immunologist.
Yeah, of course, sorry. I might have a little bit of a bias. But you can go through it and become immune, or you could get a vaccine and become immune.
Right.
And I think that when you have immunity and you have memory, then you don't worry about getting exposed because your immune system is ready for it. And if you think about it, think of it like the flu. The first time you had the flu when you were a child, it was very severe.
Mm-hmm.
And you had it for at least 2 weeks, and it was probably terrifying to your parents. But now when you get the flu as an adult, you probably get a 24-hour flu because
Right.
you've seen it so often, your body knows how to respond to it. And I think eventually that's what we're going to see with this virus. It's going to circulate annually like upper respiratory viruses do. There's no way for us to go and kill it. So at this point, I expect that it's going to circulate, and we're just going to have enough people who have immunity that it won't circulate as widely as it is this year.
Right. And I think my philosophy, and this is just my personal philosophy, is that I'm not God. Even though I'm trained to be a doctor, the more I think I'm smart enough to just go killing everything, whether it's a bacteria or the next virus or the next virus, is these things have been around way longer than we have. And they're intelligent, they're smart. And that's why I think I love this quote and the whole concept of host and terrain and all the things. Obviously, if you do have it, and we do have medicine, it's great to use science, but it can really stress people out if they're thinking just locally right now that let's just find something to kill this, and I always think it doesn't work like that.
It doesn't work like that. No, we have to figure out how we're going to survive with it in harmony.
I love that.
Believe it or not.
I love that. How can we prevent the spread? So, and when I say prevention here, I just want to reiterate that we are not saying that you can prevent getting it. We're
Nope.
talking about preventing it from you ending up in an ICU bed, you ending up with a ventilator, you ending up dying from this, and then you hopefully being able to, if you get it, which many of us are going to get this, how do you recover from it? So,
Yeah, so I think that's a fantastic question, because when we're talking about how we prevent it, first of all, preventing spread, the best way to do that is the 6 feet, right? That's the best way to prevent spread. How do we look at severity and recovery? This is where we're having to take care of our own body. And this is where we really, if you haven't seen a naturopathic physician or nutritionist or people to help you figure out how to make your body be optimal, then now's your chance, right? Most naturopathic physicians and nutritionists and Chinese medicine practitioners, they're doing telemedicine, and they can help you figure that out for yourself. And everybody's body's different. So actually doing that one-on-one with somebody and figuring out what it is for your body, I think is important.
I love that. And just a disclaimer, Dr. Zwickey does not work with me or our clinic at all. Like I
just met her this morning.
I love that there's an immunologist out there that is helping the terrain, and that speaks volumes of.
Well, if your terrain is right, then that's about your body's innate ability to heal itself, which is the immune system. So as an immunologist, we have to love that.
Yeah. How does this compare to the flu? Let's talk about, the fatality, and there's a lot of noise around, this is so big or this is not big because We are not measuring and testing everyone. We're only testing the people who severely are ill.
That's right. So right now, with who we're testing, we're seeing about a tenfold increase in death compared to flu. But think about how fast people have been dying. People go into the hospital feeling poorly and feeling like they're struggling breathing. And then many people can succumb to this illness within 2 or 3 hours. That's not what happens with flu. So if we're looking at this infection, it appears to be significantly more severe than flu. Yeah, and I think until we have more accurate numbers, we won't know exactly how much more severe.
Yeah, I think this has been answered. What can we do? Let's talk about the immune system, your expertise, and then my favorite, I think, as every naturopathic doctor philosophy is, you start with the gut. And
Yeah.
this is the perfect time to bring this up, the gut immune connection. Can you talk about that?
So the vast majority of what you are exposed to comes in through your mouth. And that means that the majority of your immune system is in your gut, because that's where things are often going to start. We like to say that about 80% of your immune system is in your gut. What that means is that all the foods that you eat have a huge impact on your immune system. Now, some of those foods have a direct impact, like vitamin A and vitamin D. Others of those foods impact the microbiome, the beast within our gut, all these little microorganisms. And all of those organisms are going through metabolism, just like you are. But if they're eating foods that they like, then they produce chemicals that feed the immune system. Their metabolites are helping the immune system find balance in your body. If you're feeding your microbiome things that they don't like, then they throw temper tantrums. And as a result, your immune system doesn't do so well. So you might like those things and crave those things, but your microbiome is not craving them. And you're only as healthy from an immunological perspective as your microbiome is. So if you have dysbiosis, meaning how many times a day do you poop, not how many times a week, which a lot of people will say once a week. That's not right, right? You're supposed to poop like after every meal. That could be a sign of dysbiosis. How much gas do you have? Do you have loose stools? Like all of those things that you might experience and think, oh, that's normal. Find out what normal is, because a lot of times we have what we call gut dysbiosis, and that's directly affecting your immune system and your ability to fight infection.
I love that. So I have to put my 2 cents in. This is a big issue because most people, if they don't have colitis or blood in their stool or mucus in their stool, they're thinking they're fine. But any signs of gut issues, such as even anxiety, even depression, we've seen that certain bacteria in the gut, when we reintroduce it, it affects your mood. But gas, bloating, seeing undigested food in your stool, feeling sluggish after you eat might mean you don't have enough stomach acid. And that's why I think God created acidity, so that when you eat these bugs, it can destroy it. So one of the biggest things I see is people get tired after they eat lunch or dinner, or they crave sweets after, because their brain is like, where is the sugar from that meal? It's not coming because there's not enough stomach acid to digest it. So many of the symptoms that most of us have are an indicator that that system is weak. And again, like I said, it doesn't have to be something very severe, such as abdominal pain or.
It doesn't. It can be something as simple as brain fog. Yeah.
Yes.
Yeah,
Absolutely.
we're also seeing that the gut is highly involved in the nervous system. So all of the neurotransmitters that you make in your gut as well as your brain, which means that, again, if your gut is unhealthy, that you can trace it to a lot of neurological disease that we experience.
Like serotonin is made mainly in the gut, right? And that
And
converts to
dopamine.
melatonin.
Mm-hmm.
So your mood, how happy you are, how motivated you are right now, even to exercise at home or eat well, could be from a serotonin deficiency. It's not just depression, but even sleep, I find often is because you don't have enough serotonin to begin with. and anxiety. So I'm happy that you said that. The gut is sort of the reason why we start there, is because your nervous system and your immune system both are
They're
housed
both
there.
there. And then I think the other thing to remember, it's our interface with our environment,
Yeah,
right? So best to keep that protected.
absolutely. Yeah, so another way I always tell my patients to help them improve digestion is to make sure they're relaxed while they're eating. So it's important as we keep talking about what to eat, but
Yeah.
the state you're in when you're eating is even more important, because you could be eating an amazing meal, but if you're stressed and worried and you're on the computer and you're in your Zoom meeting right now, you're not going to digest it, right? All
Exactly.
right. So, what about the fetus? You know, I see a lot of pregnant females who are worried right now. Has the evidence
Yeah.
shown that this can pass on?
Yeah, no, there's no evidence at this point that this is passing to fetus. It is suggested vaginal births right now because we doing surgeries is not a good idea when there's a pandemic happening in the hospital around you.
Right,
So recommended vaginal births, but no, there's no evidence that this is going to fetus, unlike Zika virus. Remember that one,
right,
which
yes.
was attacking pregnant women? This one doesn't seem to be doing that.
Wonderful.
And there's also no evidence at this point that it can go through breast milk.
Exactly, yes. I actually interviewed an OBGYN from Italy who actually just published the most data on 42 pregnant women with COVID-19. That's exactly what he said. Can pregnant women get this vaccine when it comes out, or medication right now if they have it, such as, Plaquenil or such?
Yeah, so that's a great question. And I think it's going to be dependent on the vaccine. So we know that there are 52 different vaccines in production right now.
Hmm.
Some of the vaccines are highly experimental, and some of the vaccines, it really depends on the vaccine. So if the vaccine is a killed vaccine, or if it is a protein vaccine, then yes, pregnant women will be able to get those vaccines. If it is an attenuated vaccine, it is highly unlikely we will give it to pregnant women. So just going to depend on which vaccine comes out first, and it'll be just like flu, where some flu vaccines are recommended for pregnancy and other flu vaccines are not.
Can you quickly comment, for someone who knows nothing about vaccines, what
Mhm.
kind of different vaccines are there? I know there's a lot of controversy in the live ones versus the nanoparticle. How could this one, what kinds of vaccines are they looking at for this virus?
They are looking at all of the alternatives. So, an attenuated vaccine is a live vaccine where the virus has just been made to be not virulent. So, they'll take out the virulent proteins, but they'll leave the rest of the virus intact. Typically, those stimulate the best immune response, which is why we make them, but they also can have the worst side effects. Killed vaccine, we literally throw the vaccine in some formaldehyde or heat kill it, throw it in the microwave and kill it, and then we can administer that. And that vaccine is dead, which means it's usually safe to administer.
Right.
The other main vaccine that we tend to use is a protein vaccine, where we might just use the genetic material or use the protein itself for that spike protein that we were looking at earlier. And certainly multiple companies are focused on that spike protein. And if we just use the protein, it's perfectly safe for pregnant women. It's perfectly safe for children. However, it's not going to be as immunogenic, which means you're not going to get as long an immune response to it. They're trying to overcome that. One of the vaccine companies, I think they're called Modera, they're doing something really unusual, which is something we used to do back in the 60s and prior, which is scarification. So when we made smallpox vaccines, what we did is we scarred the tissue. And if you scar the tissue, you get a much stronger response so people who have smallpox vaccines have little scars on their arms, but you get a much stronger response to the pathogen. And so, but they're going to do it in a different way. Instead of using microneedles and scarring the tissue, they're using microneedles that are made out of sugar so that they dissolve. And it'll feel something like a piece of Velcro attacking your arm. So far, they've experimentally run this through phase 1 and phase 2 trials with other viruses and seen success. We don't know yet if this is going to work for coronavirus.
Okay. So this could take like how long for this vaccine to come out, and how long do they check the safety? Like I would assume at least a year.
Well, usually you check safety for at least 2 years. Due to the crisis that we're experiencing, people are trying to get vaccines out in 6 months to a year. So safety tests will happen on the public.
Wow. Okay. All right. So can someone be immune to this without actually contracting it? And my original response was no, but talk to me about that.
Yeah, so they're finding that some individuals have antibodies for coronavirus, not this coronavirus, but for previous coronaviruses that are binding to this coronavirus. So
Wow.
some individuals have some immunity in the form of antibody prior to actually coming in contact with this coronavirus. Now, it's been shown to be both good or bad depending on the individual. For some individuals, those antibodies that are pre-existing can actually help uptake of the virus into immune cells. And it's dangerous. But for others, they seem to actually be reducing the severity of infection. So again, most of that data is out of China, where they've had time to now go back and look. But yeah, they have individuals who have antibodies already.
Okay. Will this change year to year? And is it the S spike that mutates?
Yes.
And so, yeah.
So far, the S spike is not as mutagenic as the hemagglutinin protein is in the flu. So when you think flu, we talk about H1N1. H stands for hemagglutinin, and it is that hemagglutinin protein that is so mutagenic that every time we see flus circulating, we have to change it.
Wow.
But for coronavirus, that spike protein doesn't appear to be as mutagenic as flu. It appears to be about as mutagenic as HIV.
Okay, interesting. What's involved in testing? How?
So we've got, two primary ways that we test. The most common way we test is PCR. Mm-hmm. And in PCR, we're looking for little segments of RNA that the virus has that humans don't have. And so they'll go looking for those segments of RNA, and that's how we know whether you have virus. We now have a antibody test. Now, keep in mind that antibodies can bind really, really tightly, or they can bind pretty loosely. And so the antibody tests are not optimized yet. They do exist. This is how we're doing some of the rapid testing, where we can get a result in 45 minutes. We can't usually do that with PCR. PCR takes longer, which is why people were having to send in samples, and it was taking, 3 to 7 days to get samples back. When we can do antibody testing, now we can do very fast testing. However, because we're in the infancy of antibody testing, those tests aren't as good yet.
Right.
In other words,
so that's just a regular blood test, the way we check IgM, which would mean that you currently have it, or IgG would mean you were exposed to it in the past. We're not finding that to be yet as specific. And right. I think I've heard that sometimes people will test positive and then they go negative, and then they can go, so it's not accurate how long that IgG will even last for.
Yeah, so IgG typically has a half-life of 23 days, but IgM has a half-life of 3 days, 3 to 5. So you could test positive for IgM and then 3 days later test negative for IgM. IgG, it's going to be around for usually the half-life is 23 days, which usually means it'll be around for up to 6 weeks. So IgG will be there. But it could mean that you already had the infection and it's gone, right? It's just the tests aren't the best yet. And when they're testing stool, they're testing PCR again. So they're testing for viral RNA in the stool.
And if someone's COVID-19 positive, will they always have it in the stool, or did they have to ingest it, and did it have to go through the gut?
It looks like they had to ingest it in order for it to be in stool.
Okay, wonderful.
Mhm.
And how accurate are these results? And I think you mentioned the most specific one we have is the nasopharyngeal swab, right? That we've seen.
That's right. And those results are fairly accurate, like 97% accuracy rate. So um, it'd be very hard, unless you had another coronavirus,
Yeah.
you shouldn't get a false positive.
And there are companies now, I think they're all coming out with all these tests and kits, but are we still advising that not everyone just goes out and gets this test done unless they actually have symptoms and saving these for people who really need the testing, or is
Yeah,
that?
we are still recommending that. So think about it this way. Let's say a company produces 5 million tests, and it sounds like so many tests.
Mhm,
You got to remember there's 18 million people in New York City alone. There's
mhm.
another 7 million people in San Francisco alone. So the people like where the hot spots are the ones who we really have to push the testing with. Where there aren't hot spots, it's still considered a luxury to be able to get a test.
Right. And we can understand why, I have a lot of patients who just want to know, even myself, because we want to know, should we be worried? Are we immune? Did we actually get exposure and we're fine? Or no, I really need to be careful and continue quarantining. I think it's mainly for that people are so anxious just to know, is this a big deal for me and my kids and my family? Or can I relax and just know that I've already been exposed?
I completely agree. And I've had this and recovered
Mhm.
based off symptoms, right? Because
Yes.
they weren't doing testing,
Yeah.
but I've had all the symptoms. And now I'm 3 weeks out. It'd be really interesting for me to know, am I shedding?
Yeah.
Doubtful at 3 weeks, but according to the Chinese, if you can have shedding for 37 days, I could be shedding, right? So how careful do we need to be? And this is going to be how people actually get to go back to work, is that if we know we're immune, we could send those people back to work. And right now, we just don't know.
All right. So just to recap for everyone, I know we're out of time. Lifestyle is key, and we are here. Most of us are doing telemedicine at the university, and we accept insurance. We're doing Zoom meetings, so it's actually great. We have group visits, and we'll talk about supplements and diet and herbs and nutrition and exercise and what's right for everyone. So exercise is key, but let's say you actually have like no cortisol production all day and your adrenals are burnt out. You may need to do more yoga and stretching and not hit training every day. So we really want to tailor your care to you, not just because COVID-19 is going around, but just we do that anyways. And as you said, starting with diet and lifestyle and working with a naturopathic doctor or functional medicine practitioner, osteopathic doctor, acupuncturist, nutritionist, exercise physiologist. Now I feel like the acronym Nick after my name isn't as relevant. It's about what kind of medicine we practice. And this is the beauty of root cause medicine and acute care conventional medicine coming together. I mean, it's never one or the other. This is when we need the integration of both systems. I think that's when we'll see the most success, just like we see in oncology, just like we see in any chronic disease. So I want to thank you, and I want to just you to share one more tidbit about how you're doing to stay positive and stay safe during this time for everyone.
Yeah, please. What I do is I get outside every day.
Mhm.
And I happen to live out in the country, so it's easier for me. But if you can't get outside, open your windows, breathe some fresh air, and you'll be amazed how good even that will make you feel.
Amazing. Thank you so much for your time. I hope you'll join me in the following weeks. We're going to get into the details of the science, looking at all the vitamins and minerals, including zinc, vitamin D, vitamin A, elderberries, echinacea, astragalus, and the list goes on. We are compiling all the data right now, and I would love, Dr. Zwickey, for you to come back and talk about the science with me.
Sure, sounds like my daily regimen.
All right, everyone. Thank you. Bye bye.
Bye bye.